Don't be fooled by milk fever. The truth behind the name. The term milk fever can be misleading, especially when you hear it and think that a dairy cow is suffering from a high temperature or fever. In reality, milk fever has nothing to do with fever at all. It's actually a metabolic disorder known as hypocalcemia, or low blood calcium levels, which often occurs around the time of calving. Despite the name, milk fever doesn't cause a fever. Rather, it's a condition that arises when the cow's body is unable to maintain an adequate level of calcium in the blood, leaving her vulnerable to various health issues. Understanding this condition and its causes is key to better management and care of dairy cows. Milk fever typically strikes shortly after a cow gives birth, when she starts lactating and begins producing colostrum, the first milk she produces. Colostrum contains high levels of calcium, up to twice the amount found in regular milk. This significant calcium drain during the first 24 hours postpartum can overwhelm the cow's body, particularly her ability to draw on calcium reserves from her bones to meet the demands of lactation. This sudden drop in blood calcium levels can lead to muscle weakness, reduced appetite, and in severe cases, even paralysis. Older cows are particularly susceptible to milk fever. As cows age, their bodies experience changes that make it harder for them to mobilize calcium when needed. They lose vitamin D receptors in their intestines and osteoclasts, the cells responsible for breaking down bone tissue to release calcium. These changes reduce their ability to absorb calcium from their diet and mobilize it from their bones, leaving them more vulnerable to hypocalcemia. The real key to preventing and managing milk fever is recognizing that it's not a fever at all. It's all about calcium metabolism, and managing it starts before calving. Ensuring that cows are well prepared with proper nutrition before they calve is essential. Providing adequate calcium supplementation in the weeks leading up to calving, as well as using specific feeds to help balance calcium levels, can help to minimize the risk. Monitoring older cows in particular and understanding their increased vulnerability is also critical in minimizing the occurrence of milk fever. In conclusion, milk fever is a deceptive term, as it's not related to fever, but rather a deficiency of calcium that can lead to serious health issues in dairy cows. Recognizing this condition for what it really is, hypocalcemia, is crucial in implementing effective management strategies. With proper nutritional support, early intervention, and better management, dairy farmers can help prevent this condition and ensure healthier, more productive cows. So next time you hear milk fever, don't be fooled by the name. It's a serious condition that requires careful attention and action, not a temperature check.